Right, now, good afternoon, Miss Stewart.
Good afternoon, my lord.
You have a witness for us.
Thank you. I do. Giving evidence this afternoon, my lord, is Miss Mitchell of Glasgow, Caledonian University, who will give evidence on graduate apprenticeships and placement-based learning.
Very good. Good afternoon, Miss Mitchell.
Good afternoon, my lord.
Right, Miss Stewart will have some questions for you. On you go, Miss Stewart.
Thank you. Can you please confirm your full name for us, Miss Mitchell?
Susan Victoria Mitchell.
And on behalf of Glasgow Caledonian University, or Glasgow Caledonian for short, or GCU, you provided a response to the inquiry's Rule 8 request for information, is that right?
I did.
And my lord, that is to be found at reference SCI-GCU-5 zeros and a 1. Miss Mitchell, you are the Chief Operating Officer and Deputy Vice-Chancellor at Glasgow Caledonian, is that correct?
Yes.
And how long have you held that role for?
Over 6 years.
Thank you. Can you tell us a bit about what your role at the university involves typically and also in relation to the pandemic period?
Thank you. Yeah, I manage the vast majority of the professional services functions, so non-academic functions at the university. But during the pandemic, I was also the COVID lead for the university, so that meant liaising with my counterparts in other Scottish universities, with University of Scotland, and therefore with the Scottish Government around matters of policy and decision making.
Thank you. And in terms of what we want to ask you about today, apprenticeships is part of that. Your response sets out that Glasgow Caledonian is a leading provider of graduate apprenticeships. But before we move on to that, can you give us an outline of the university as an entity in terms of its size, the number of students and apprenticeships, and the types of courses offered?
Of course, yeah. Glasgow Caledonian is the leading and largest modern university in Scotland. We offer a range of programmes across areas like business, accounting, law, health and life sciences, computing, engineering. There are around 23,000 students. It's a mix of home students and international. We're a very large institution. We have, most of our degrees are very much geared towards future employment, so useful degrees that give qualifications that employers are looking for from our students, which is most likely why we have 91% of our students, according to the most recent data, are in full-time employment or indeed further study 15 months after graduating. It's worth noting that 22% of our students are from the country's 20% most disadvantaged backgrounds. We are the largest nursing provider in Scotland. We're the largest provider of allied health professional education and the largest provider of graduate apprenticeships.
Thank you. And indeed it's those three courses, if I can put it that way, that I want to ask you about: the graduate apprenticeships, I beg your pardon, the allied health professions and nursing. First of all, the apprenticeships. What is a graduate apprenticeship?
So a graduate apprenticeship is when somebody who's already in employment comes into the university on a part-time basis, so they are working and earning, studying and earning at the same time, in order to secure a degree of some description, either an honours degree or a master's degree.
And how long does it take to obtain a graduate apprenticeship?
Typically 4 to 5 years.
And you mentioned in the Rule 8 response about the academic schools you have within Glasgow Caledonian. Within which of these schools do the apprenticeships typically sit?
So they're in two of the schools, the School of Business and Society and the School of Computing, Engineering, the Built Environment. And
in terms of the sorts of professions or trades the people studying an apprenticeship can hope to enter, can you give some examples of those?
Yes, so we'll be talking about the construction industry, or we might be talking about software development, accounting, business management of some description, AI, data science, those sorts of industries.
Thank you. You mentioned at the outset that these apprentices are in full-time employment and attend university part-time. Can you give an idea of how often they attend university? Is it sort of weekly or in blocks of time?
The usual format is about a day a week, but it does vary from programme to programme depending on the sorts of industries people are coming from. So they might attend, we might set it up so that they attend for a more protracted period, say a week at a time rather than a day, but typically it's a day a week is the norm.
Are we to understand that the format for these apprenticeships means that the practical elements of their training are done while in the workplace, and the theoretical elements are done at the university, or is there more of a crossover than that?
So that's correct to say, but it's also true that the assessment needs to cover, that the university oversees cuts across both the workplace and the academic side.
Thank you. I want to look now with you at the impacts on those apprentices. And if we think to March 2020 and what we're terming and what's commonly termed lockdown, there will have been some working for their employer and some at university. Can I ask you to describe just in broad terms for us the impacts on these two cohorts, perhaps taking those at university first?
Yeah, so they wouldn't be wholly at university or wholly at their employer. Most likely at the time they would have been a combination of the two through the week. And so the impact was very similar from an academic point of view that it would have been for any undergraduate student. So the students, of course, had to study from home, but of course in most cases they were also working from home those days when they were working for their employer rather than doing their academic study.
And in terms of the impacts they experienced, are they broadly the same as those doing other practical subjects, for example?
Yes, absolutely. All study moved online. The only difference would be that for the days when they would normally have been in their employer, typically they obviously couldn't be doing the practical work and therefore had to be at home. Some of them, of course, were furloughed for the period. A small number were made redundant. And so then there was then another challenge about how do we then support them to secure alternative employment.
Okay. We've heard from a panel of college principals and another panel just this morning comprising university principals about the impacts on practical subjects and a little bit about the impact on apprentices. Would you say there were more or fewer negative impacts on apprentices, I beg your pardon, because of their link with an employer, for example?
People may see it in different ways. I would argue that perhaps, well, it might be argued that there was less of an impact on a graduate apprenticeship individual because they had other support networks. So they had the support of the university. They will also have had the support in the main from their employer. But it will doubtless have varied from individual to individual.
You set out in your Rule 8 response for us that when the reopening of campus was permitted, or at least permitted to a degree, you prioritised those doing practical courses. Did that include apprentices?
Yes and no, depending on the particular programme of study. It would have included, because that practical element is typically in the workplace. So from our side, from the academic side, they wouldn't necessarily have been a priority.
Okay. In relation to the impacts on apprentices, you've set this out at various sections of your Rule 8 response, but if I may focus on what's said at section 3H, page 15. You've got a heading there, GCU Graduate Apprenticeships Insights, and you set out here the scale of the graduate apprenticeship offer that you have at Glasgow Caledonian, 345 apprentices and 200 employers. Mm-hmm. You say this is offered across 7 programmes.
Yeah.
Are we to understand the programmes as different to the schools?
Yes, a programme of study. So civil engineering would be a programme of study, accountancy would be a programme of study, and those are component parts within a school. So within a school there might be an undergraduate degree in accountancy, but there's also a graduate apprenticeship qualification in accountancy. They run side by side.
In that same section, you explain that the scale of the apprenticeship offer made it difficult for the university to manage, on one hand, continuity of education and on the other, employer support. Could you explain to us a bit about the relationship between the university, the apprentice, the employer, and how that works?
So we have a dedicated team who recruit GAs, as we call them, into the university through the employer. So they work with the employer at the outset, typically often helping an employer to define what skills and qualifications they need to develop to enable their own workforce moving forward. So there is, at the very outset, there is a triumvirate relationship between the student, the university and the employer. That became quite critical during COVID because that team were able to liaise with the employer and make sure that suitable support was being provided to the student, but also to make sure the employer's needs were being met and whether anything needed to be flexed in the programme one of the things we were able to do really successfully at the university is flex a GA programme to meet the needs of the employer, which could of course have changed during the COVID period. So we were able to do that through that very careful business partnership relationship.
Can you tell us a bit more about what that might look like in terms of what you were able to do? Would it be to alter the order in which you taught certain component parts or something different?
Thank you, yeah. So we very much changed the chronology of events, excuse me. So where there might have been a period of learning followed by a period of placement, not placement, sorry, that's the incorrect word, by a period of time in the workplace, if that time in the workplace couldn't happen, we moved events around so that some of the academic learning was consolidated at a period of time when the individual student couldn't go into the workplace, which is incredibly helpful. It maybe meant that the sequence wasn't the ideal sequence, but it meant that the students could continue their studies and come out the other side of COVID without having had a significant detrimental impact. That negotiation and navigation was quite special from a graduate apprenticeship point of view, and I think was incredibly helpful for our students.
Should we understand then that there wasn't an impact in terms of delay in qualification or career progression in that regard?
That's correct, yeah.
Thank you. You speak about a large component of the apprentices during COVID being employed excuse me, in the construction sector, and you've mentioned today in your evidence about furlough being a significant feature. What impact, or to what extent, did that have an impact on the apprentices?
Yeah, I think for those that were furloughed, it was obviously a very concerning time. And one of the things we spent a lot of time doing as an organisation is providing reassurance and support. However, furlough wasn't as challenging as being made redundant, and we specifically needed to support those individuals who couldn't complete a graduate apprenticeship if they didn't have an employer. So actually in that instance, in those instances, we were able to try and work with the individuals and our network of employers to find them alternative employment to enable them to continue with their GA programme hugely successfully.
Thank you. To what extent was redundancy a problem for the apprentices?
It wasn't huge, but of course each and every case is huge to the individual.
Indeed. And what about furlough? Was that a widespread problem across
It was a reasonably common occurrence.
Thank you. And is that solely or predominantly in relation to construction or across the piece?
I would have to have a look at the numbers to tell you that, but I could find that information and share it.
Thank you very much. We might come back to you and invite you to do that if that's something that wouldn't be too onerous. I want to move on to asking you now about allied health professionals training and their placements in particular. You've mentioned that GCU is the largest provider of courses relating to allied health professionals. What sort of allied health professionals study at the university?
So there are 12 AHP, as we call them, disciplines, and at the university, Glasgow Caledonian, we offer 8 of those 12. Our 3 largest programmes are physiotherapy, occupational therapy and dietetics.
And am I right to understand that all of these AHPs require to have placement-based learning?
Yes, that's correct.
You've set out at section 3D at the very top of page 6 that lockdown caused significant impacts on the practice elements of these AHP courses. Can you explain a bit about these impacts? For example, did the placements cease or were they modified in some way?
It was a huge impact, actually. All of our AHP students were on placement at the point when lockdown happened. In the very first instance, they stayed in situ. I think some other institutions may have withdrawn their students. We didn't do that, and our working assumption behind that was that students are studying to go into those professions, and once in those professions, they wouldn't be withdrawing. But that was the very early days. Thereafter, quite quickly, a few issues emerged. One was that the individuals that were working alongside our students on placement were called to the NHS front line, so they had to come away from their normal working role. And of course, without them there, the students can't be on placement. The second one was that PPE was not provided. Unlike nursing students where PPE was provided, PPE was not provided to AHP students. And the third element that arose was that it became clear that there was no death in service indemnity arrangement in place for AHP students. So they had to be withdrawn from their placement rules.
Thank you. You set out in this section that, I can quote from your Rule 8 response, you say, in the early days of the pandemic response, the picture was confused. No overall leadership regarding the decision-making about what to do about student placements was forthcoming, and as a result, the placements were cancelled in dribs and drabs. Obviously, the picture there is painted as one perhaps of uncertainty. Can you explain the impact on the students and the university of that situation?
Yes, it was a deeply uncertain time. A lot of thought went in very quickly to what we would do with, not what we would do, but what would happen nationally with nursing students, less so in terms of AHP students, which of course when they needed to come out of placement would have caused significant worry to our students. What does this mean for my studies? What does it mean for the timeline of my studying and acquiring my qualification, and what's going to happen to me? Also consequential impact for our academic staff who had to act very quickly to find an alternative solution. What actually happened in practice is that the HCPC, this is the regulator for AHPs, too many acronyms, I'm so sorry, they made a decision to allow us to move away, students could move away from having to complete a fixed number of hours in order to secure their accreditation towards being able to demonstrate competency. That was a hugely helpful and incredibly important moment. So what that enabled was our academic colleagues to shift the placements into a simulated environment in the university. Extremely difficult to do, it's not normal practice. Well, there is an element of that, but it's not normal practice on that scale. And to illustrate the point, there were 60,000 hours of physiotherapy placement time that were lost to our students. And those hours, not the hours, but because of the regulated change, but the learning experience and a demonstration of competency had to be shifted into the university environment, completely different from anything that had been delivered before. So it was a huge impact. And I think it would be fair to say that while many, many extraordinary things were delivered by my colleagues during the COVID period, this is one of those ones that really strikes me as being something quite special. And if I may, I would say they did it for two reasons. They did it to make sure that our students could continue their learning and feel supported. But they also did it because if they had not done so, the critical supply pipeline to the NHS would have gone. So the actions they took meant that that pipeline was sustained.
Thank you. In terms of how the decision to work in that way in terms of their placements came about, you mentioned at section 3D, the foot of page 5, that you worked with partners such as health boards, for example, to adapt and innovate placements. Can you tell us a little bit more about the partnership working that was necessary? Clearly it wasn't merely, or rather simply, the university and the accreditation bodies, but there was other partners.
Yeah, there were other partners involved, and that was about distilling what's essential. Some of that was about front-loading theoretical learning where that needed to be done to enable placements to happen. A little bit like the graduate apprenticeships where we had to change the chronology of events. Our colleagues in this department had to do that. But also understanding, bearing in mind, of course, nobody knew how long this was going to go on for, and it's up to a 4-year programme, depending on what year the student was in when lockdown happened. It was then a case of sequencing what learning needs to happen when, what placements need to happen when, or what placement experience needs to take place. So there was an enormous amount of negotiation, engagement, discussion, reframing, changing, learning, changing assessments. It all had to be reshaped. It's almost impossible to describe the scale of change that had to be quickly enacted, in a matter of weeks, to enable those students to be able to continue.
What was the impact on the students of having their placements modified in that way? Was it largely positive? As you say, it permitted them to continue with their studies?
I think after it had been initially very disconcerting, for many students this was reassuring because everything in our power was being done to enable them to continue successfully. So that's really positive. I don't think there's ever a substitute necessarily for placement experience, and the fact that we could get students through the competency demonstration was incredibly important, but maybe wasn't the experience that they had expected. And I guess that will have inevitably had an impact when they come to the workplace. So we've been thinking particularly there about not so much competence, but confidence.
Thank you. You've set out a little bit about this already. At the foot of page 6, you say, in some programmes, clinical module leaders were responsible for creating alternative clinical assessments and exams in digital format. So
yes.
We've been focusing on the placement so far. I understand from your relate these were patient-based but not in a clinical setting. Can you explain a bit more for us about the assessment of the AHPs?
Yeah, so the assessments that would have taken place during the placement period could no longer, it's not just the placement itself that couldn't happen, the assessment during the placement couldn't happen. So that also went into the simulated environment, which meant that from a design point of view and a pedagogical point of view, it had to be changed. So the whole thing had to be reconstructed from the beginning.
And was that done by simulating a clinical environment within the university?
Yes, it was.
Thank you. And was that done online or was it?
No, it would have been in person.
You've set out, and you've alluded to it a short while ago when you mentioned confidence and competence. In your Relate response, you note that one consequence of the various impacts on placement-based learning and assessment is that we now have what you term clinically naive students, and that there is at least a perception of there being a COVID cohort. Can you explain a little bit more to the inquiry about that?
Well, I think it's fair to say that these students have had a very different experience. It's impossible for me, I don't work in that field, to directly compare and contrast the two, but it seems logical, and my colleagues tell me that clinically naive is an expression that's used. Not sure that I particularly love it, because the competence has been demonstrated, and I think it's really important that we stress that. But I can only begin to imagine that if it were me, I would feel maybe less confident in that setting. I think that's a human feeling, a human response to the situation.
Okay. You mentioned in your response also that the university's ability to deliver placement-based learning to the allied health professionals hasn't quite returned to pre-pandemic levels. Can you explain to us why that is?
Yeah, there are two reasons for this. The first one is that post-COVID recovery meant people were distracted, and the ability to offer placements to that scale became more difficult. The second one is that because of COVID, the way that some of these AHP services, think of them as outpatient clinics, is possibly a useful way of thinking about them. Very often the form in which those are delivered in society fundamentally changed, for example, moving online. Therefore, as a consequence, there are fewer placements available. And that has a significant consequence for, well, partly for the university, but the longer term consequence is for the NHS in terms of the supply pipeline again.
In terms of the impact on the university, is that because you can't recruit these students to these courses?
Yeah, when we recruit students to these programmes, we recruit numbers only when we are certain that we can provide the placement experience. So all of that placement planning 4 years hence has to be carefully mapped out. So if we can't secure the placements, we can't offer them the learning hours that they need to secure their accreditation. So we can't grow our numbers on the back of that. And we therefore know there is a gap between the numbers we can recruit into the university, the numbers we can train, develop, and then supply into the workforce. There's a shortage.
Are we to understand from that then that the university hasn't continued with the format of delivering this alternative placement model that it had during the pandemic? The university doesn't do that anymore.
Yeah, the competency was a temporary arrangement, but we're back to hours.
Okay. I want to turn now with you to looking at the third aspect of your evidence today, and that's the mobilisation of the nursing students to supernumerary paid placements. But before I turn to that, I want to ask you a bit about redeployment of allied health professionals. You've mentioned that there was redeployment of those already in the workforce. and the impact that had on students who couldn't shadow or work alongside them. But you've set out in your Relate response that certain AHPs were redeployed to frontline roles, and I'm thinking in particular of the Vision Centre, and I'm not sure whether or not that, perhaps you'll explain whether that is an allied health profession or not, but that they at the Vision Centre were redeployed to a frontline role. Can you explain a bit more about that redeployment for us?
So you're right, vision science is not an allied health profession, however it is a delivery of health in the environment. So it's a different regulator, it's the GOC, the General Optical Council, who regulate the vision sciences. At Glasgow Caledonian we have a vision centre, by which I mean it's a large optometry practice, which meant that our students could still continue not continue all the way through. It was closed. It was the very first thing we reopened on campus at the request of the Scottish Government, if my memory serves me right, and that meant that our students could then work in the Vision Centre alongside our staff and get that experience that they would have got before, but at a much earlier stage than perhaps it was recreated for the AHP students. So that was a positive experience, and they were provided with PPE and in due course lateral flow tests. Lateral flow tests being something that weren't provided to AHP students at an earlier stage. So that actually worked very well. So it is a proper clinical practice that exists on campus that members of the public can book an appointment and go to. Perhaps not that well known, but it's an interesting facet of what we deliver.
And pre-pandemic, would those students have had placements in that Vision Centre?
Yes, effectively. And
in terms of were they paid placements they had when they were redeployed?
No, they're not. No, absolutely not. When you make an appointment to go to the centre, you are seen by a qualified clinical practitioner and a student side by side.
Thank you. And that continued in the same way during the pandemic?
It closed for a period of time, and then when we were able to reopen the Vision Centre, that restarted.
Thank you. I want to move on now to asking you about the impact on nursing students. And at page 10, you set out some of the issues affecting these nursing students. And I want to go through the deployment of these student nurses at various stages of their training to work within the NHS. You say here that year 2, we can take that first of all, year 2 nursing students from all 4 fields were recruited to work as AFC Band 3 nurses in health boards and care homes. I wonder if first of all you can tell us what's meant by all 4 fields.
I won't get them all right, but for example, adult nursing is a field of nursing, child nursing and so on, mental health nursing, and I can't remember what the 4th is.
Thank you. And in terms of the AFC, what does that stand for or mean?
Can you tell me where it is in the...
I beg your pardon, sorry, it's at page 10, and the section entitled Year 2 Nurses. I'll just find it in my hard copy papers. And we'll put it on the screen in front of you. Oh, I beg your pardon, I think I may have the page reference wrong, please bear with me. Sorry, it's page 12. It's about halfway down, entitled Issue 1, and you called it Mobilisation of Student Nurses into Non-Supernumerary Paid Placements. And this is the first line there, Year 2 nursing students.
Yes, I see it. I can't immediately recollect what AFC stands for. I will find out, confirm back to you.
That's fine, that's something that we can look into, and perhaps I don't know if you're able to explain to us about what Band 3 means in respect of the nursing profession. Is that the entry level upon graduation?
Yes.
Thank you. Did the student nurses have both theoretical and practical component parts to do after or in year 2 and following?
Yeah, there's both theoretical and practical. Where students, for example, year 2 students were being redeployed into the workforce as a Band 3 nurse. we front-loaded some theoretical aspects before they went out. So we made sure that they were prepared for anything they might encounter. And then their time they spent redeployed to the front line counted as equivalent hours in clinical placement terms.
And in terms of the theoretical elements of their training, did that, when they were redeployed, did that continue, or was it exclusively front-loaded, as you say?
No, the theoretical side did not continue. They were employed. That's what they did. And then it was only when that came to an end that they went back to the theory side. That said, they were supported throughout by nursing colleagues who provided emotional, technical support and advice via a helpline. So there was a connection back to the university.
In terms of what their placements on year 2 would look like pre-pandemic, can you explain what that may be in terms of contact with the university and supervision, for example?
Yeah, so yes, a student goes on placement, they would be supervised in the workplace. There would also be regular contact with the institution throughout, and the assessments would be reviewed. So it would be a sort of a three-way conversation, if you like. This was slightly different in that they were redeployed to the front line, so it wasn't an assessment situation in the same way. So it was tantamount to working in a conventional role.
And with, you're saying they were given the same level of supervision as ordinarily?
Yeah, absolutely. They weren't left unsupervised. Just should be clear about that. They were absolutely supervised in the workplace.
Thank you. And you speak again about the year 3 nursing students, that they could be bank nurses between April and September in 2020. And they did their practice learning environment assessments during that time. Can you tell us what the practical learning environment assessments are?
In terms of the band 4 nurses?
Yeah, just in terms of I think it relates to the band 2, 3 and 4. They have practical learning environment assessments.
Yes.
I think you mentioned 7, and in year 4 they have 8.
Yes.
Can you explain a little bit about what these are?
I don't think I'm qualified to comment on that. I could describe in broad brush terms, but that's not my field at all.
Thank you. We could explore that elsewhere. And again, for the year 3 students, is it the same situation as you've described for year 2 in terms of support from the university and the employer?
Exactly the same, yeah.
You mentioned that students in year 2 and 3 were able to opt in or out of these paid placements. And did they, by and large, tend to opt in or opt out?
Most students opted in. On the one hand, this could be seen as a fabulous learning experience, quite unique for many students. However, some couldn't opt in, not because they didn't want to, but because they had circumstances that prevented them from doing so. For example, somebody in their household who was shielding. So that was tricky for those individual students who effectively that practice learning phase of their studies ceased at that point and then had to be returned to later.
Thank you. And for those who opted out, what was the impact of that on their learning?
So a material impact, and it varied from student to student depending on where they were on their learning journey, but for some students it was up to a 2-year impact. Because unlike the AHPs, where there was a shift from the regulator from hours to competency, in nursing it remained hours. So unless you had done the hours, you couldn't get your accreditation. So yes, a material impact for students who couldn't go through that experience.
Did they experience a delay in qualifying?
Yes, they would have been delayed by anything up to 2 years.
And again, I noticed you mentioned in terms of opting out, that was open to the year 2 and 3 students. What about the year 4 students? Were they able to opt out?
Well, they were quite different because they had reached the end of their studies effectively, so they were able to graduate and go into employment.
So they'd finished the end of their theoretical training in year 4 and...
Yeah.
Thank you. Again, in terms of the practice learning environment assessments, and you might not be able to answer this, but you mentioned that the year 4 students undertook this while on placement, and they then became fully registered nurses. I don't know if there was any impact arising from doing the practical learning environment assessment in real time while on placement during the pandemic.
I couldn't comment on the experience, but I can comment that there was no delay to any of them completing their studies because of this.
Okay. I want to ask you a little bit about broader impacts on the students and on the university. You mentioned there about the simulated placements that you required to offer, and you mentioned at page 7, about halfway down, that there was a financial cost to the university. I'm wondering if you can expand on that a little bit more for us.
Yes, so because moving, if we're talking about the simulated placements, we're back on AHPs, because moving the placements into a simulated on-campus environment where they don't normally happen, that was a significant endeavour that is not part of our normal business model, certainly not at that scale. Therefore, we needed staffing, resourcing, space, facilities to enable that to happen. So there was a significant cost. I think, if memory serves me correctly, I think in April 21, there was Scottish Government funding provided to support this, but that was 12 months in, over 12 months in. And we at Glasgow Caledonian used that funding to recruit clinical educators to support that process. That meant that the academic staff could be freed up to focus on the assessment side of the operation. And the reason we did that was to increase the throughput of students, because there was a rate determining step happening here. We couldn't get the throughput to be high enough to meet the needs of students in terms of their 4-year learning journey. So this additional funding that was provided in April 21 was incredibly helpful for making sure that we could up the throughput and get those students through the system.
Thank you. In terms of, we've spoken a bit about the AHPs and the placement-based learning, and you've explained the redeployment of some of those professionals they work alongside. I wanted to ask you a little bit about how the change and how these professionals worked once they returned to their ordinary duties. For example, you mentioned that they undertook telephone consultations, and can you tell us a bit about how their duties changed and how that impacted the students working alongside them?
Well, I suppose twofold. One is that the far more patient-facing interventions were not face-to-face. Therefore, it's a different experience for the student. Also, there was a diminution in community-based placements because of people not wanting to share vehicles. So it's an obvious thing that is, but it's not immediately obvious, but actually you can see how that would arise. I'm trying to think what other impacts there would be. I think the main thing is the volume of placements, the fact that the methodology changed, but also the other thing was that we did a lot of peer-assisted learning. So we would put more than one student into an environment, and there would be peer-assisted learning that took place structured. That had to stop because of physical distancing and the requirement to have a reduced number of people in any one location. So it changed on a number of different dimensions.
And in terms of the assessment of these students, would that ordinarily involve observing them, conducting such consultations, yes, for example?
Yes, exactly.
And how was that impacted?
It meant the pace that could be done at, and again, for us, in an organisation of our scale, it's about volume of throughput. So that slowed things down.
In terms of the move to online learning and teaching and the increased role of telephone consultations and IT in the conduct of these professionals' work, we're thinking about digital inclusion, and it's something the inquiry's heard quite a bit about. Is that something that impacted the students that you work with, particularly the allied health professionals and the nurses?
Well, it impacted across all student populations, not just those. We work very hard as an institution to make sure that students were not negatively impacted by lack of access to digital technology, resources, be that the actual kit or quite often Wi-Fi access, those sorts of things. So we put an enormous amount, as well as Scottish Government funding that was provided to a degree to support that, we put additional funding in to make sure that no student was impacted. So any student, regardless of which portfolio they're in, could contact us for support, to support that. Scottish Government called it digital poverty. We didn't call it that. We call it digital inclusion.
And is that something that the students did in large numbers? Was it a widespread problem, would you say?
It was a very widespread problem. We did 2 surveys of our students, I think in the May of 2020 and the November of 2020, to understand what they were facing. Some of it wasn't all digital challenges. Very often, if they're in the home environment, there are plenty of other people in the home environment, therefore finding a quiet enough space in which to work was a significant problem, which is why we prioritised reopening spaces on campus that were socially distanced to enable them to return where they really needed to. And we worked with students to understand their individual needs so that we prioritised those who really needed it the most. But certainly from a digital point of view, we provided hundreds and hundreds of pieces of kit to enable students to continue their studies, without which they would not have been able to continue.
And in terms of the 2 surveys, you conducted one in May, quite early on in the pandemic, and November. Did you see that problem reduce in terms of its severity?
It did reduce. I would say it took time for students to necessarily grasp, feel comfortable, understand that they could come forward for support. That was quite a slow process. It's quite a different thing. We'd never done anything like this before. No university, to my knowledge, had done anything quite like this before. So it took a while to roll that out. I think a lot of students struggled by. Trying to write an essay on a phone is not easy. A lot of students struggled by thinking this is just a short-term issue. And of course, eventually, over time, we needed to provide. We always provided alternatives, but eventually more came forward seeking alternative support.
Okay. You've mentioned there working from home and online learning from home, and you mentioned your Rule 8 response, and you've alluded to it just there about the impact of a lack of space. And I know that you had a number of students who were in halls of residence. You highlight that in your Rule 8 response. Can you talk a little bit about the impacts on those 2 cohorts, those who were within halls in terms of their access to an environment to work in, and then also those who perhaps were living elsewhere, either with family or in shared accommodation, for example?
So we've worked incredibly hard as an institution to understand what the individual needs are of our students. In halls in particular, the one thing I would want to highlight, quite apart from, I'm sure, my colleagues who were in earlier today have talked about the impact on students in halls, but at Glasgow Caledonian we also have the largest cohort in Scotland of care experience students in our university. They don't all live in halls, but a significant number do. So when universities were required to close, you've already said earlier what you mean by close, for many students this was their home. They couldn't go home, this was their home. And so therefore, and they were isolated when we were in lockdown, not being able to work. And that had particular impacts for students who rely on part-time employment to pay for their student accommodation. And they were furloughed or 0 hours and had no hours available. That's why we were the first university in Scotland to remove charges for university accommodation to all our students. We took that decision very early because we knew that if we didn't do that, there were a number of students who would probably have to leave university, and that wouldn't be a good, successful outcome. So that was an early decision. We did it for everybody, not just for certain individuals. So it was a material impact, and providing well-being support of all kinds, whether they were just isolating or whether they were actually had COVID as well, providing that support for our students was significant. Now, there was a second part to your question.
It was those who don't live within halls of residence, and perhaps you've alluded to earlier on today the access to space to work.
Thank you, yes. So the vast majority of our students at Glasgow Caledonian don't live within halls of residence because they live in the local community. So a significant proportion of our students live within 10 miles of the Glasgow campus. Therefore, for many of them, they are living with their families. There may have been other adults in the household also having to work from the home environment. There may have been children needing to do their schooling from home, and there may have only been one device that they were sharing between them. So we took the opportunity to survey those students, to make contact with them, to understand what their needs were, and to support them wherever we could. We took a very open-minded approach to what is it that we can do to enable you to succeed.
The impacts on mental health and well-being was something that I wanted to ask you about as well, and you've mentioned it a bit there. Can you describe some of the mental health impacts, first of all, on the staff?
Generally on the staff. Huge impacts. I think probably it's only in hindsight that we really understand that. When I have been reflecting on the COVID experience in preparation for this inquiry, I found that I was more struck now by what was achieved then than I was at the time, possibly because we were simply coping. When I talk to staff about what they did and what they achieved, I'm deeply struck by how much they did just off their own bats. They just did what they needed to do to support the students, which is actually quite astonishing. So they did things they wouldn't ordinarily do. They did things in timelines they wouldn't ordinarily do. They provided different methodologies, different forms of access, different forms of mental health and well-being support. How we cared for students it's a central part of what we are as an organisation. And not every student needed the same support, so we really worked hard to make sure that we aligned the needs and the support requirements. But I simply am astonished at what my colleagues achieved during that time. And when I look back now and I think about, in particular, nursing colleagues, I mean, it was all colleagues, but nursing colleagues and allied health professional colleagues that we've talked about here today, what they achieved was nothing short of miraculous. And we are incredibly proud of that, but we've moved on. And reflecting on it has been incredibly useful for us.
In terms of the impacts on staff, you've explained about the pivot to online learning.
Yeah.
Did that impact them in relation to their workload?
Yeah, hugely. So a significantly increased workload. And for other staff who might do research, because a lot of staff obviously teach and do research, if they would have been doing research during that period, that went onto the back burner. So there's been all sorts of consequences arising for staff. One of the initiatives we did was a post-COVID research reboot to try and give staff an opportunity where they hadn't been able to conduct research, sometimes because of COVID itself, or sometimes because of what they had to do for us to support students during that period. We've had to rethink how can we now get them back on track. But so the impacts were far-reaching and very diverse.
Thank you. You've mentioned a bit already about the impacts on students, but if I can ask, you mentioned in connection with digital inclusion that you had run some surveys and that had brought to your attention the nature and extent of the issues students faced. Was anything similar done in connection with mental health impacts, or how did you become aware that was an issue?
Yes, so my colleagues in our Student Life Directorate, who work extremely closely with students in all sorts of guises, including mental health wellbeing and counselling, would have gathered a huge amount of information about the number of students reaching out for additional support, not just during lockdown, that was a significant factor, but afterwards as well, in terms of the longer term, getting back on track with their studies, reconnecting with the institution. For some students coming back to campus, we know that this is a generalisation, so I'm slightly hesitant to generalise, but we know one cohort of students that actually benefited from lockdown was some students with disabilities found it easier to engage in their studies by being able to study from home. Coming back to campus presented new challenges, and that manifests in lots of different ways. So the support that was needed was not just for that fixed period, it's a long-term, ongoing support endeavour.
You've mentioned there about disproportionate impacts on those who are disabled, and you've also mentioned care experienced. I wanted to ask you about disproportionate impacts, if we can take on different cohorts of, we'll take the students first of all. Did you see disproportionate impacts in connection with those who are living in poverty, or you've mentioned the disabled already? We did, and colleagues worked really hard to adapt whatever was needed for them. But actually the main difficulty was getting to understand what is it that students need. As a general rule, they don't shout for help always. So many do, but often they don't, particularly if they've not shouted for help before and are not in the system. So colleagues did a lot of reaching out to students to inquire, to seek to understand, rather than, so there was a pull as much as anything, not just the push factors. So it varied, the experience varied hugely from cohort to cohort, from programme to programme,
and from different dimensions that you describe, be that disability, care experience, whatever, a hugely variable experience. So this was not a single one-size-fits-all situation. So the level of nuance we've needed to apply then and since in how we support our students has been extraordinary.
In terms of the disproportionate impacts, we've heard a bit about the impact on international students. Does your university have a significant number of international students?
Yeah, we do, and our international student population grew significantly during COVID and has remained very high.
And would you say that they were disproportionately impacted as a cohort of students, or is it broadly the same as the rest of the student body?
It was a very different experience. So I would imagine you've already heard that when learning was online, for a lot of international students who could remain in their home country and still study, that was quite helpful to them. They didn't have the added cost of coming to the UK, but of course that has gone, and now they need to be in the UK and comply with all UKVI requirements, which means attending classes and living where they say they're living, and we monitor and manage that as an institution. So I think the impact was variable across the piece, depending again on their programme of study.
Okay. In relation to the disproportionate impacts on certain cohorts of staff, I wonder if there are any particular cohorts of staff in terms of their discipline or their socioeconomic situation that makes them disproportionately impacted.
Yes, well, there will be, absolutely. I think staff who are delivering programmes that have more practical aspects, who needed to be on campus to enable that to happen. And I've mentioned a few here today, but ones we might not have mentioned, for example, would be specialist computing programmes where they use particularly high-spec kit that isn't typically available in the home environment, where students needed to come onto campus, and then therefore the academic colleagues needed to be on campus too. Though there are impacts there that that aren't immediately obvious from an external point of view, that we needed to manage. Now, there were things we were able to do to help that, but depending on what programme you're teaching, you might be able to continue online quite happily if it's, say, I don't know, social science or something, versus a more technical programme which requires specialist equipment.
Thank you. And you've mentioned the impact on staff in relation to research, and that some of them, because of the workload, had to stop their research activities. Can you tell us a bit more broadly about the impact on research?
I'm not sure I can give you a general thing because it does vary from discipline to discipline. One of the things to know is that at Glasgow Caledonian we did a huge amount of research connected to COVID. So that research continued with a huge health research profile, which is incredibly important. Other research, depending on whether it is lab-based research which had to stop, or whether it's desk-based research which could continue in the home environment, it varied enormously across the institution.
Thank you. I wanted to ask you about ongoing impacts and some of the things you've mentioned there, perhaps, whether or not they are still ongoing impacts. You mentioned disabled students. Are they still able to learn remotely, or are they all back on campus?
They are largely back on campus. We still do some remote learning, but we constrain that to a fairly moderate level so that students are getting the wider student experience.
And in terms of mental health impacts, are there ongoing aspects of that for students and staff?
There are. There has been a significant growth in all institutions on mental health incidences, if you like. That's not the right word, but requests for support, let's call it, for mental health. Can't put that down entirely to COVID, but there was a significant uptick at that point in time, and that has continued since. And particularly mental health and other disabilities, individuals presenting with more than one, so managing several conditions at once. I'm not sure the precise number, but I want to say something in the region of 22% or 24% of new students report some form of a disability of some description. That's a very significant number.
In terms of new students, I wanted to ask you about new intakes and ongoing impacts, perhaps, for the cohort of students who were in school or perhaps in college immediately prior, or perhaps during COVID, and are now at university. Has there been a discernible impact on that cohort?
Yes, I think there has been, because their whole learning experience has been disrupted. So their expectations are different. The assessment methodologies, as you well know, were different for over the piece. So actually, the dynamic has shifted. We found students looking to have less dwell time on campus, which does most definitely impact the broader student experience. We also have students very keen for their time on campus to be consolidated. And a lot of that is because they're seeking part-time employment for the rest of the week to support them in their studies. So it manifests in many, many different ways, and none of that I see changing in the near future.
Has there been a discernible impact on the students' social skills, for example? Their perhaps what could be termed their emotional resilience?
I think my colleagues in student life would say yes, there has. But there's certainly been a clear impact in more students reaching out for support from that.
Thank you. And you've said you're not sure if that can be attributed to COVID or otherwise, but you notice an uptick in that. I want to ask you just briefly about communication with the Scottish Government. You explained earlier in your evidence about you being the COVID lead for the university, and that involved engagement with the government. Were the impacts that you've articulated for us today, and also in your written response to the inquiry, were they relayed to the government at the time of their decision making?
They were, repeatedly. Sometimes decisions were made and we knew at the same point in time when it was released to the public. Sometimes we had a little bit of advance notice on decisions that were being made at every single opportunity. And I forget precisely, but I want to say we met them weekly. I think that's what we did. We met so often. We continually sought to help government officials to understand the actual impact of their decisions rather than their perception or their anticipated impact of the decisions. And that was quite tough going, because it's a very nuanced business, and there were quite a lot of assumptions made about what students are, who they are, how they work, the sort of environments that they live in, what they want to get out of their studies. And we had to work as a collective, and we did work incredibly hard to help officials to understand, if you do this, this is the consequence. Now, sometimes we were able to get, I wouldn't say decisions changed, that would probably be going too far, but we were able to influence decisions at a reasonably early stage before things were done that were going to have a catastrophic effect, but not always.
Thank you. And the inquiry will, of course, look at decision making and implementation, so it's helpful for us to know that the impacts were relayed at the time. Just in closing, and I'm finishing earlier than I anticipated, are there any key lessons Glasgow Caledonian University thinks should be applied, I suppose, to try to mitigate the impacts, and you mentioned the ongoing impacts?
For us, it will be about talking to universities and understanding exactly what the impact is of every decision that's made, and not just the immediate impact, but the longer term consequences. Very often we felt that students were stigmatised in the thinking about what needed to be done, and then we find ourselves in a situation where the pipeline to the NHS is affected. There are serious long-term consequences to what happened that we sought to influence very robustly throughout the COVID experience. I think where we felt listened to, we were able to influence. That's really positive. Not being able to influence was extremely frustrating, and there were times, for sure, when decisions were made that we were worried were going to have a catastrophic effect on students. Some of them were quite awful, and we had to push back very firmly indeed, so that things weren't implemented that were planned to be implemented. For example, we were briefed in December of 2020 that there was consideration that students wouldn't be allowed home for Christmas. And our strong advice to government officials was, do not do that. It will be catastrophic for the mental health and well-being of our students. to leave them wherever they are in Scotland, away from home, not with their families, potentially in distress. They'll be very vulnerable. And that decision was changed, which was really positive, before the students became aware. But then, of course, the students came home, and only after they'd come home they were told they couldn't just go back. That was quite tough. And engaging with that on a very human level, as a parent with a student at university, that was really very difficult. We worked extremely hard as a collective. That's one example of hundreds of examples. We worked extremely hard to try and make those points. And it wasn't always straightforward. So it's for me, some of the, I know we're not here to talk about decisions, I understand that, but if we're talking about impacts, references to class sizes of 30, you've probably covered this already earlier on today, that being the maximum class size you can have without thinking about the space, the environment, the learning experience, the allowing institutions to apply principles and making sensible decisions. Instead, it was terribly prescriptive, and that without a doubt, impacted on our students' learning experience, because we were deeply restricted on what we could bring back to campus when we were allowed to bring things back to campus for a very, very protracted period. I don't know how well understood that is, generally, but it was exceptionally controlled. So we weren't free to make sensible decisions based on a core set of balanced principles that we would then apply. It was extremely prescriptive what we were and weren't able to do. And I didn't think that was helpful.
Thank you. I want to just pick up on something you've said there in terms of the guidance that was issued then. Was it your duty to interpret that guidance?
Yes, but we did that as a collective, so there was no sort of local interpretation, but a lot of it didn't require interpreting because it was so prescriptive. So no class sizes higher than 30, for example. But yeah, my role was to take the guidance and then fathom how on earth is this going to work in our environment. Air quality monitors that we were asked to put into teaching and learning spaces. Institutions have hundreds of teaching and learning spaces, and we can put them in. How are we going to monitor them? Mm-hmm. So lots of things that just were not that well thought through, that we then had to think, okay, right, how will we make this, how will we operationalise this in a way that's sensible for our students, doesn't increase risk for staff and students, but enables people to continue their studies and achieve what they came to university to achieve.
In connection with your answer at the very start of your response there, you mentioned the pipeline to the NHS. Mm-hmm. Is that related to the difficulties with placement-based learning?
Yes, absolutely.
Thank you very much. I don't have any further questions for you, Miss Mitchell, unless you have anything, Lord.
No, I've got no questions for you, Miss Mitchell. Thank you very much for coming and giving your evidence.
Appreciate
that. Very good. That is all for today, and we're back tomorrow morning at 10 o'clock. Thank you all.
All rise.